Hi, my name is Corinne Waldo. I'm the Senior Director of Economic Vitality at the Boulder Chamber. Thank you for joining us for this week's cross-industry support session. We're back with our normal presentation with somebody from Boulder County Public Health. And as people are joining us, we will get her started in just a minute. Just as a reminder, please put your questions in the Q&A. That's an easier way for us to do it. If you're not able to access the Q&A, I should be able to grab them out of chat. In addition, just know that we are doing these every other week for right now. And then that schedule is for the next couple of weeks. We'll see what happens after that. At this time, I'm going to hand it over to Tessa. Tessa, why don't you take it away?
Great. Thanks, Corinne. I'm Tessa Hale with Boulder County Public Health, and this is our presentation to share the data, the most recent data on COVID-19 as of January 25th. So again, this is the same as the last time we reported a few weeks ago. The data patterns here in Boulder County are reflective of what's happening across the state and nationally. We have a backlog of data. There was such a huge amount of cases happening that the system was stressed in terms of tracking and reporting of data. So please note that this data could change in coming weeks as we're able to get caught up on that. Our case numbers remain similar to last week. They are a little bit lower than the peak we had on the 15th of January. We're seeing hospitalizations beginning to decrease, and hospitals are still experiencing challenging. So while the rates of people in the hospital for COVID are decreasing, we just want people to know that that is sort of an artificial number in the sense that there's a backlog, probably a 6-month backlog of other kinds of surgeries and procedures that have been put off in order to ensure that there are hospital beds available. There are still severe staffing shortages, and there's also supply chain issues happening. We have seen an increase in deaths, which I will get to in another slide. And finally, test positivity did decrease slightly this week. So you can see here that we are in a decline of cases, which is good. We are still extremely high and much higher than we've been in over a year. Across Colorado, cases are decreasing, aside from Gilpin County. So you'll see that just in general, the cases per 100,000 are declining. In terms of our capacity for case investigation and contact tracing, we are still highly below our capacity for doing that. It'll be some time before we get back into a place where we can stay on top of that. As you see here, case among age groups, it's declining across most age groups. We are seeing it is different with our 12 to 17-year-olds. There is still a higher rate of kids having that. And then between our 35 to 44-year-olds, there was another increase in that age range, as well as 23 to 34-year-olds. Our testing day, 7-day testing positivity rate has declined, not dramatically, but it is in a slight decline. When we look at hospitalizations right now, the number of hospitalized patients did decrease by 3%. The ICU bed availability is still at 7%, and the medical and surgical bed availability is also at 6%. And I would just want to reiterate what I said a minute ago, is that hospitals are keeping beds open for potential influx of COVID cases, and they are not performing other kinds of surgeries or procedures that people are having to push off as they're maintaining bed availability for COVID cases. There is tight staffing, 62% staff shortages, which is also the same as last week. And we now have 55 pediatric confirmed cases of COVID-19 in our area hospitals. Almost 50% are 0 to 4-year-olds. Right now, 104 people are hospitalized with confirmed COVID-19, and there are 9 staffed ICU beds available. In terms of health system responses, there are surgical masks in all settings for healthcare settings. The transfer plan, which means patients coming in from other counties and being transferred to support resources based on staffing shortages and other kinds of supply shortages, is at tier 3. The crisis standards of care was activated on the 7th of the month and is still activated, which means that triaging decisions are having to be made based on availability of bedding, beds, and staffing. Avista reopened on the 18th of January, which is really good news. There's extremely limited availability of the different kinds of medications to treat COVID in the state of Colorado. And so right now, those medications are being allocated based on severity of cases, and we're hoping that we'll see an increase in productions. Common seasonal flu hospitalizations remain low. RSV hospitalizations peaked in December, and they're now low. We've had 87 deaths since May 2021 and 344 total deaths since the beginning of the pandemic. I highlighted this last time and just will highlight again. If you look at the beginning of the pandemic, most of the deaths were related to long-term care facilities. More recently, these are people not related, and someone in their early 50s did pass away last week. Right now, if you take a look at the 220,000 Boulder County residents with a full course of vaccination, we are at almost 67% of people are fully vaccinated. We're continuing to push out vaccinations right now at the Boulder County Fairgrounds. There's a drive-up clinic, so you can just go drive through, really easy to make an appointment online. I'll be sure that Corinne can share that information, but you just drive up, roll down your window, and you can get a vaccination, and it's free. With regard to boosters or a third dose, we continue to see more people making those appointments, getting a third dose. That Boulder County Fairgrounds site is a great place to go and get a booster shot if you are eligible for one. And we'll talk a little bit more about that in a minute. Here's that flyer on the clinics, and you can scan the QR code. You can make an appointment. There's no ID or documentation required. 8 a.m. to 6 p.m. every day of the week. You can just drive on in. Here is the total number of vaccinations that have been provided. As you can see, I think the weekends are busier, but it's, like I said, a really expedient, easy way to get in and go get a booster or your first vaccination. There are free masks available now. There's a link here that you will get where you can apply to get free masks from community partners. There's a list of providers. The federal government pushed out KN95s, which is the highest standard of masks. They're available at the public library, healthcare settings, pharmacies. Everyone is eligible to receive 5 of those. And a key change that we want to communicate out is the CDC has a new term called Uptodate vaccination status. And so I just want to walk through what this means. So fully vaccinated for Pfizer and Moderna means that you have had 2 doses of the vaccine, and 2 weeks after you've had your second dose, you're considered fully vaccinated. For Johnson & Johnson, that would be 2 weeks after 1 dose. Booster doses are available to people at 5 months after they've had a Moderna or Pfizer series, and 2 months after a single Johnson & Johnson booster. Original vaccine. So what this slide cuts off part of the description. Boosted is the day after you're boosted, you are completely up to date. And it means that you are at the highest level of protection, and more data is coming out that shares that when you are boosted, you are highly protected against Omicron. And we now know that there's an Omicron B, which we don't have a lot either 5 months of Moderna and Pfizer or 2 months after a
So can you go back
Johnson
to
&
that slide? I
Johnson.
think we'll cover something real quick that came up last week that we can do while we're on this slide. When you say a person is boosted up to the date right after getting, that doesn't protect them if they were exposed just prior to being boosted, correct?
Correct. And you would not, you would wait until you are asymptomatic. If you were sick in between your fully vaccinated status and your plan to get a booster, you would not want to get a booster while you are still actively sick.
Great. Yeah, we just had a question from a business or a couple businesses last week that said, this person was exposed here, got boosted here, didn't know they were exposed. Did that booster cover the exposure prior to the boost? And the answer to that would be no.
Right. That is correct. And the day after you're boosted, you are then fully up to date immediately. And then here's our resource page. So that's our presentation for this week.
Okay, so we have a question that came in, and I might try to find the chart, but there's businesses who have staff that are refusing to get boosted, but by not being boosted and being eligible for a booster, it does change both your isolation and your quarantine rules, correct?
Yes, and I can pull that up too. Yes, so let me get our new isolation and quarantine information.
And this is that updated chart of the one that I've mentioned many times, which is a flow chart of when and where you have to quarantine and isolate. They did update it, and it's something that I literally have above my desk because I have so many questions about it.
Yes, I can share what that looks like now.
There are a couple more points to this question, but I want us to go over this real quick.
Are you able to see this?
Yes, we can. Maybe zoom in a little bit so it's not so hard to see.
Okay. Hang on.
There you go.
Okay. So if you are positive for COVID-19, whether you're not vaccinated or fully vaccinated, you would immediately isolate. And you would wear, so the difference basically here is if you're, I guess we should just go through, if you're not vaccinated or you're due for a booster, then what you're looking at is you would need to be quarantining. You would isolate for 5 days and stay home until you're no longer having any symptoms. And then you'd be wearing a mask for 5 days. If you're exposed to COVID-19, you stay home for 5 days and you need to wear a mask 5 additional days. Avoid travel and being around people who are at high risk. And you would test afterwards on the 5th day after you've been exposed or after you become symptomatic. If you've been exposed to COVID-19 and you are fully vaccinated and boosted, you go ahead, you isolate, you get tested, and then you can retest 5 days after exposure if the initial test is negative. At that point, if you're still negative, you're ready to get back to your normal business. If you've been exposed, you do not need to quarantine if you're fully vaccinated and boosted. You do need to wear a mask for 10 days, avoid travel and around people who are at high risk, test on the 5th day after exposure. So the big difference here is that if you're fully vaccinated and boosted, you are able to go to the grocery store, go do your things, but you need to wear a mask. If you are not vaccinated, then you would need to be staying home. If you're not boosted and vaccinated, you need to be staying home for 5 days.
All right. And then the second part of this question is something that you may not be able to answer, but it has to do with, do I have to pay for that quarantine? And do you have to pay for the quarantine and isolation time? And the answer comes under the Healthy Families Act Colorado. And I did send out that information, but it is the extension of that public health crisis in which it is extension of the paid sick leave does take place, and it is for COVID quarantine isolation, and it's the equivalent of 80 hours if they're full-time or adjusted based on the part-time. I will put the link in to the poster for 2022 in the chat so that you can continue to get that. And then the website, the Colorado Department of Labor and Employment, as long as we're under a public health crisis, there's still that piece. So I will put the CDLE link in for that particular act and the 2022 poster momentarily. So testing, Tessa, can you talk a little bit about the difference between, a lot of people are, getting access to the state tests or the national tests, and they're getting the boxes in the mail. So are those the type of tests that can get you out of quarantine? Oh, you got yours right there. I got mine today, and I made sure I got it out of the mailbox really quickly because it is cold out and they have a temperature range. Can you talk a little bit about the difference between that test and a PCR, and if you should rely on a negative of an at-home test as your, I can go see grandma and I can go back to work after exposure type thing?
Yes, thank you for that question. So the difference between an at-home test and a PCR test is significance in terms of their ability to detect whether or not you have COVID. So right now, they estimate that home tests are 85% accurate, and that they're really most able to catch, to detect COVID when you are more symptomatic or have a higher viral load. Whereas a PCR test is up to 98% accuracy, and it can detect COVID-19 prior to you being symptomatic or having mild symptoms. And so if you do have a sore throat, a scratchy throat, any of the symptoms of COVID, we recommend getting a PCR test because you may have a negative COVID test. I know several people who have had negative COVID tests when they're feeling kind of sick. They also have a PCR test and that comes back positive. So if you are symptomatic and have a negative at-home test, it really is best practice to go and get that PCR test to confirm.
Thank you. All right. So do we have any other questions out there? The questions we get during the week are those gray areas, like we talked about just a minute ago. I have somebody that's boosted, but they got exposed on this day. And are they considered boosted, and which part of the quarantine rules? I think businesses are trying to navigate those, their case-by-case situation. And so the flow charts and those types of things can continue to be helpful resources.
Yeah, and I would just encourage during this time, we are still in very high transmission, even though cases are declining, and to support continuity of operations for businesses, we just really urge if people are symptomatic, not feeling well, it's really best to stay home than to get coworkers or patrons, guests, visitors sick.
All right, so this actually came up with someone I know. Everyone in my house has tested positive for COVID. However, I have the same symptoms and my PCR tests are negative. Should I assume I'm positive? And I had a friend who third time's a charm on their PCR. They did everything, the isolation, because their whole family was positive, and the third time they did test positive on a PCR test. So should that person assume that they're positive and take the steps?
Yes, thank you. It's, sometimes tests are not detecting it, and it's safe to assume in that situation that that person is COVID positive, and best to, out of an abundance of caution, to quarantine with the rest of their family.
Well, and especially since in a family situation, especially of young kids, it's really hard to separate if you have a 5-year-old, for example, that's COVID positive, you're still going to need to be a caretaker for them. So you're probably going to need to isolate with them as well in some cases, unless you have a very responsible 5-year-old that wears a mask, stays in a separate part of the house, can, not interact as much with some other people. Any other questions? So KN95s, or the K95s or the different versions of those, I know those are highly recommended in they're providing some at the libraries and other areas where you can get them. If you're in Louisville and Superior, you can get them from your local chambers because of some additional support Boulder County was able to give the fire impacted areas. But, you know, the 5 that you can get, or the KN95s, is that really the, you know, the mask that public health is recommending at this time?
Yes, thank you. We are highly recommending those really well-fitting masks. There's a significant decrease in transmission and protection by wearing those really well-fitting masks that provide additional, that are thicker than maybe the medical masks or cloth masks. We also just want to reiterate that bandanas and gaiters, a single ply gaiter, those really aren't providing protection. And so, you know, the best is to get those KN95s or similar. Medical masks are also protective. I know that there are cloth masks that have filters in them. It's really about the fit around the face. And so if there's gaping parts here, it's not going to be as protective. And that's why the K95s are really the best that we encourage people to use.
Those are the ones that look like duck beaks that we've seen all around. So any other questions? I mean, at this point, we're covering a lot of the questions we'd have over the week. I do have one while we're waiting to see if anybody else, my last call. What's the modeling saying right now? You know, they don't know much about Omicron B, but what's the modeling saying? Are we moving in the right direction, or, you know, is that still ambiguous?
Great question. You know, the modeling is indicating that we are in a decline. And as with everything has happened with COVID, there's still so many unknowns. We do know that there's this new variant, Omicron B. We don't know what impact that will have. And it also depends sort of on how people continuing to maintain mitigation strategies of wearing masks, of being vaccinated, of social distancing, and all those other things that are really supporting people to remain healthy as possible. And so with things staying as they are now, we are seeing the modeling show a decline in cases.
With the caveat that there's still that backlog of testing, you know, out there that may change numbers at all, or is that taken into account?
That is taken into account. And along those same lines, it's also important to note that for all the people who have a home test that don't register that to the state, or who don't test, you know, aren't accounted for in any of these numbers as well, which I'm sure we all, you know, have friends who may have it and for whatever reasons aren't able to test, and just that can count for a number of cases as well.
All right, and the last question, vaccine verification program. Can you talk a little bit about the status of that program, if it's still available, the current timeline for it, and then why it's still, even if we're moving out, why it's still a good program, you know, and what businesses have been saying?
Great, thanks, Corinne. We are still running the vaccine verification program. We are still promising a response within a 2-week time frame. We are encouraging all of our participants to use masking as an additional mitigation strategy. We'll be sending out a communication later this week or early next week, either tomorrow or early next week, with that information about CDC's guidance on Uptodate on being vaccinated, which would include a booster. We're not requiring people in that program to mandate boosters. It's just, again, highly, highly recommended, especially because we know that that helps to prevent against Omicron, which is our primary variant that we're dealing with right now. We still think it's an important program because if you are going to be in a space where everyone is fully vaccinated, the chance of a spread of Omicron or any other variant is much lower. We still want to provide that option to people who want to be in a space without wearing a mask. And we really, as I said, right now we're encouraging people to be wearing masks during this time of high transmission. We will be encouraging people to suggest that everyone gets up to date on their vaccines. And with those two strategies, like there's probably, it's the safest place to be if you're going to be indoors in public would be to be in a space like that.
And if anybody read I think it was Daily Camera, but one of those articles out there recently, some businesses that are in the program were interviewed, and they said these were lifelines for them, that had actually increased their business and they've had, a lot more people attend or do things because they felt safer in those environments. So I'm just quoting some of the businesses that were quoted on there. A 9 News story was done about it. We had 2 facilities in Boulder that were interviewed. We at the Chamber, we did an event last week where we had the vaccine verification program, but we still recommended masks. And I will say that 99.9% everybody in the room decided to continue to wear a mask, but they also had that extra bit of comfort knowing everybody in the room was vaccinated for when they were eating or drinking and so forth.
Yeah, thanks for that, Corinne. And that's a great demonstration of how that was really a super safe place for all kinds of people to be, because not only were everyone fully vaccinated, but also wearing masks. And looking at going forward, even as we are in a decline of cases, still thinking a vaccine verified facility is a safer place to be, to know that you will be with people who are less likely to be sick or transmit any variant that might come up.
Now, if you could have controlled the ice storm, that might have helped attendance a little bit, but that's a different story.
Yes.
All right, it doesn't look like we have many questions. We will be putting out the recording as well as Tessa's slides. Just as we normally do, I'll continue to send out the links to things like HFWA. We do have a survey out for businesses to tell us their quantitative impacts of the fire, if possible. So that's open for anybody in the region. I'll send that out because we're getting a lot of questions about fire and differentiating the impacts of the fire and COVID. At this point, I'm going to thank you, Tessa. I've seen you a couple times today, but I'm thank you for joining us today. No delivery truck this time, so we didn't get to hear your dog. Mine's in the background, but everybody else, thank you for joining us. 2 weeks from today, we'll have Lane back because Tessa's not available. So at least we have a tag team approach going there. You'll always have me, apparently. No, I'm just kidding. You'll always have me. I will leave you there.
Thank you, Corinne.
Bye.